Wearing a cloth face covering in public may help prevent the spread of COVID-19. Wash your hands before putting on your face covering. Holding the ear loops or ties, make sure it covers your nose and mouth and secure it around your chin. Try to fit it snugly against the side of your face. Make sure you can breathe easily and keep the covering on the entire time you're in public.
According to Dr. Robert R. Redfield, CDC Director, cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of the virus when used universally within a community setting. So, my mask protects you, and your mask protects me.
Key times to wash your hands. Wash your hands before eating or preparing food or touching your face. Wash your hands after using the restroom, coughing or sneezing, leaving a public place, handling cloth face coverings, changing a diaper, caring for someone sick, or touching animals or pets.
Germs are all around you. Stay healthy by washing your hands often with soap and water for at least 20 seconds. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty.
Key times to practice social distancing. Inside your home, when someone has or thinks they have COVID-19, if possible, stay at least 6 feet away. Outside your home, stay at least 6 feet away from people outside of your household in indoor and outdoor spaces. Stay out of crowded places if possible.
According to the CDC, social distancing is crucial for preventing the spread of contagious illnesses such as COVID-19. COVID-19 can spread through coughing, sneezing, and close contact. A close contact is defined as anyone who is within 6 feet of an infected person for at least 15 minutes, starting from 48 hours before the person began to feel sick until the time the patient was isolated.
Stop the spread of germs. Help stop the spread of COVID-19 and other respiratory illnesses. Wash your hands often with soap and water for at least 20 seconds. Clean and disinfect frequently touched objects and surfaces. Cover your cough or sneeze with a tissue, then throw the tissue in the trash and wash your hands. Wear a cloth face covering over your nose and mouth. Do not touch your eyes, nose, or mouth. Stay at least 6 feet from other people. If you are sick, stay home except to get medical care.
Remember, we can all do our part to stop the spread of germs by washing our hands, social distancing, wearing a face cover, and following other CDC guidance.
Symptoms of COVID-19. Symptoms of COVID-19 can include the following: cough, sore throat, fever, muscle pain, chills, shortness of breath or difficulty breathing, new loss of taste or smell. Symptoms can range from mild to severe illness and appear 2 to 14 days after you are exposed to the virus that causes COVID-19.
As part of the district's health and safety processes, all employees will be required to complete a daily health screener and have their temperature checked when they report to work. The daily health screener will be completed online. It includes 3 questions. Question 1 addresses symptoms of COVID-19. Question 2 focuses on close contact with an individual who has tested positive for COVID-19. And question 3 concerns if an individual has recently tested for COVID-19. Reporting of a positive COVID-19 case. Step 1. Positive COVID-19 diagnosis or potential disease notification will be reported to the school administrator, department head, or school nurse. Step 2. The notified personnel will contact the Office of Health and Intervention Services, the impacted staff member, and/or the student's parent or guardian. Once a positive diagnosis has been confirmed, personnel will employ confidential contact tracing, determine which areas need to be sanitized, notify close contacts in a confidential and timely manner, and provide self-quarantine guidance. Step 3. The Office of Health and Intervention Services, in conjunction with Our Lady of the Lake Health Centers and Schools, will provide the school with a parent and or guardian letter, submit a report to the Louisiana Office of Public Health, and provide the return to school guidance for students. The Office of Human Resources will communicate return to work guidance and a letter notifying staff concerning self-quarantines. Concurrently, management teams and Aramark will conduct extensive facility cleanings. And step 4, all teams will report status updates to the school administrator or department head that indicate or initiated the report.